needs to be transparently accounted for, and where all the money has gone needs to be very clearly shown and public, made publicly available. So this is just a summary. I mean, there's a lot more information on our website, but this is a summary of where the information, where the money has come from. I mean, what I think is very significant here to note, I mean, just in terms of the quantum of funds, as Martin says, around 3.2 billion rand that we've raised. I mean, this is unprecedented in the timescales that we're talking about here, to mobilize a philanthropic effort of this kind, where we had over 2,700 companies and foundations, including multinationals, who donated, and as importantly, over 300,000 individuals. And these are individuals, from provinces across the country. In fact, the two provinces with the highest number of individual donations are the Free State and the Northwest. And you're talking about people who are going into a USave or a ShopRite and asking the teller to, make a contribution of 2 Rand or 5 Rand or 10 Rand to the Solidarity Fund. So, I mean, an incredible show of support across the board in South Africa for this fund. And as Martin said, we're a fund for all of South Africa and accountable to all of South Africans. In relation to how the funds have been directed, so we've chosen, in accordance with the mandate that Martin articulated, to focus on 3 pillars. The first is the health response, and this is really to support the national health system to prepare for the crisis and to make key interventions where we would have outsized impact in helping to support the national health response. The second pillar is in the humanitarian effort, and this is in relation to our mandate to support those whose lives have been affected by COVID-19. And here we focused on 2 areas, one being food security and hunger, and the second being gender-based violence. And then the third pillar was the Solidarity Campaign. And the Solidarity Campaign initially focused on information, helping people to understand what this virus was about, how they should respond to it, and then moving on to become much more focused on behavior change, which I'll talk a bit more about. I mean, in terms of impact and reach, I think, the important thing to say is we've been very focused at the fund on making sure that we cover all of South Africa, and in particular, the most vulnerable communities, making sure that we've got a balance between urban and rural, and also importantly that, because of the way that the fund is structured, that we have partnered with organizations across society, with government departments, with civil society organizations, traditional leaders, faith-based organizations, NGOs, businesses. So this has been, a national effort where the fund has played the role of pulling together all of these different sectors of society to come together to fight COVID-19. In terms of the criteria, I mean, essentially the criteria that we were looking for was, where are the opportunities for the fund to make the biggest contributions and the biggest impact in the 3 areas and the 3 pillars that we had focused on. So these needed to be catalytic interventions. Obviously, the money that was being mobilized by the state to deal with both supporting households as well as dealing with the health response was just far than that the Solidarity Fund had mobilized. So the important thing for us was to make sure that we really targeted areas where our funds would have a much bigger impact and would and focused on areas where, had we not intervened, that impact wouldn't have happened. So that principle of additionality was really important to us. And then obviously, making sure that the impact happens at scale. So not funding individual projects or, the needs of individual communities. There was a lot of discussion early on about whether the fund should get involved in funding SMMEs. We decided that was not, even though SMMEs were obviously heavily impacted by the crisis, it was not an area that we felt that we could have a really significant and meaningful impact on. So if we look at the disbursements today, so I just want to kind of pause a bit on this slide. I think it's really important. I mean, this is really the heart of the work that we've been doing over the last 8 months. And, as Martin said, I mean, from mid-March, when there was an organization and a bank account and a website, to build an organization where you mobilize pro bono resources of, over 30 or 40 companies, over 200 individuals working either pro bono or on a seconded basis. The projects here that we committed to, totaling around 2.7 billion rand, include around 40 projects and sub-projects. involving over 200 legal agreements with counterparties. I mean, this has just been, a monumental effort. If we look at where the funds have gone, and this is really looking at areas, we're not obviously going to go through each individual project in this meeting, but the four major areas in the health response were firstly around PPE, and that was obviously when we started in March, there was a critical urgency around getting PPE into the country to protect frontline healthcare workers. And we very quickly, within a week or 2 weeks of the funds formation, we began the process in partnership with Business for South Africa, who provided the procurement hub. So all the procurement of PPE done by the Solidarity Fund was done through the volunteer group of Business for South Africa, where they brought together leading healthcare, procurement, logistics, supply chain professionals and organizations in an effort to help support in this procurement effort. And obviously at that time, the entire world was trying to procure PPE, and so this was a very difficult undertaking, but I think we were very successful in rolling out our PPE procurement plan. I mean, in some cases, it took longer than we would have liked, but very much driven by the need to make sure that we were absolutely rock solid on all the quality controls and the counterparty agreements and so on, and to make sure that the money was well spent and properly accounted for. The second area was, on the PPE, we didn't just contract to buy PPE for state healthcare workers, but also for around 40,000 community healthcare workers in NGOs across the country. We partnered with the DG Murray Trust on a very significant procurement of PPE equipment for community healthcare workers. The second area of ventilators, this arose because of the lack of CPAP oxygen support ventilators in the country and globally. We couldn't find these to procure anywhere in the world. And so we helped stimulate a local manufacturing project in conjunction with the National Ventilator Project, where we provided funding for the prototype and then orders for 20,000 ventilators, principally manufactured by the CSIR. That project was initiated in July. We already have 7,000 of these CPAP machines in hospitals and clinics around the country. In relation to testing, again, an area of critical need when the crisis struck in March, we stepped up very quickly to provide a 250 million rand grant to the National Health Laboratory Services to enable them to ramp up their testing capacity. And in addition to that, we provided financial support to the academic laboratories of the hospitals and the Independent Community Pharmacy Association to help them augment the NHLS's testing response. And so that was principally to deal with a critically urgent test of healthcare workers and others, and to ensure that they were not backlogged. They were fast-tracked through the academic laboratories and the ICPA. In terms of essential equipment, this was important. I mean, this is something that was approved a while ago, actually, during the first, over the hump of the first, that whole procurement of essential equipment had to be reprioritized, which is why there's a big gap between the disbursements and the amount committed or allocated. But we're in the process of implementing these projects now, and I mean, it happens to be extremely good timing, obviously, in relation to the essential medical equipment that we are currently procuring and distributing in the Eastern Cape. In relation to our humanitarian pillar, the two areas of food relief and gender-based violence, I mean, these are two humanitarian crises that were significantly exacerbated by COVID-19, were not caused by COVID-19. I mean, our response here has really tried to be as targeted as we can in our initiatives to have the biggest impact. So phase one of our food relief program, which rolled out very early, was to providing food parcels to 280,000 households across all 9 provinces. We worked with over 400 community-based organizations and faith-based organizations to implement that program. The second phase, we've moved away from the food parcels, and we're providing food vouchers to 135,000 households, focused on particular segments of the population who are not able to access government grants and we think are kind of most vulnerable. So very targeted and selective. And then 47,000 households will be supported, or are currently being supported with farming input vouchers, the majority of whom are women-headed. And this is to help stimulate food production in rural areas. In terms of gender-based violence, really two parts of this initiative. The first was to support the national intervention, so the Gender-Based Violence Command Center and the Tutuzela Care Centers. And the second has been, which we've put out a call for applications now, is to support, we're hoping to support around 350 community-based organizations across the country to help bolster their efforts to deal with the scourge of gender-based violence in communities across the country. And then the final pillar, which is the behavioral change pillar, was a solidarity campaign, and this has happened through a major communication effort across the country. I mean, I won't go through all of them, but right from the end of March or early April, we began with the radio campaign. This is in 15 local radio stations across the country, 12 languages, reached 28 million people. These are daily 10-minute inserts, just dealing with the COVID pandemic. And really helped to move people away from fear, help them understand what this the COVID crisis was about. And we have now supplemented the communication program with a behavioral change program, which is called the Citizen Solidarity Program, which has been running for the last 4 or 5 months, which is really about driving the behaviors that we need to contain community transmission. So it's mask wearing, it's physical distancing, it's hygiene. And this has not been done only through communication, traditional communication channels, but also in partnering with trusted institutions, organizations in society, civil society organizations, the schools, faith-based organizations through the Southern Council of Churches, the workplace through the Return to Work campaign, working with youth NGOs to access youth. So trying to use the trusted networks to drive the behavioral changes that we need. I'm not going to go through this in detail. I know that this was asked. I mean, just at a high level, different kind of.
Hello.
Yes, sorry, Chair.
Can you talk to the last remaining 7 slides
in a couple of minutes?
For 2 minutes, because
yes, sorry, Chair. I will.
25 minutes of engagement.
Yes, sorry. I will speed up. So, I mean, this is really just to say that. I mean, our main mode of operating was to partner with others. We partnered with B4SA to procure PPE. We partnered with civil society organizations to deliver on our programs for the humanitarian efforts. It was only in the National Ventilator Project where we did direct procurement ourselves, but also partnered there with the National Ventilator Project. I mean, just quickly in terms of governance, I mean, the governance of the fund really, I think, has been exemplary. Obviously, we had to kind of build the organization as we were, executing on our mandate. But very strong fund administration, our monitoring evaluation, the legal support that we have, the internal control environment, the way that the board subcommittees and the board works. I mean, just to let you know, since March, the board and the board subcommittees have had weekly standing meetings. I mean, this is the kind of intensity of effort that we're talking about here. I mean, in terms of specifically around disbursements, I mean, very clear governance process around disbursements, where it comes from, the technical, from advisory committees to get the biggest, best and strongest input into an executive disbursements team, up to a disbursements board committee, and then onto the board. Numbers and the lessons learned, we can touch on those in the discussion. Really just to say, the fund has now completed what we describe as the crisis phase of the fund. And we were kind of set up to respond to this crisis, as you can see on the slide. But we're now in a new phase, what we think of as kind of phase 2 of the fund, which is this phase of living with coronavirus, where our health systems are intact, have responded to the first major wave. That's not to say, and we obviously see a very worrying signs in the Eastern Cape, but it'll be very different the next 12 months compared to the last 8 months. And we are now focusing on what's needed from us, which we think are going to be key strategic interventions in the health space, obviously continuing with our humanitarian efforts and our behavioral change efforts. Chair, thank you very much.
Okay, thanks very much for the presentation. Honorable members, those who want to ask clarity-seeking questions or make comments, can you indicate by raising your hands? Tebuho, you will assist me in identifying members who want to make contributions or want to ask clarity-seeking questions.
We have Dr. George and Mr. Shivambu. and Mr. Morolong.
Okay. Dr. George, then Honorable Shivambu, Honorable Morolong.
Thank you, Chairperson. Good morning, colleagues. Thank you very much for that presentation. Firstly, I'd like to say thank you very much to the Solidarity Fund for what you have done for South Africa in this very difficult time. It really has made an enormous difference, and thank you. I have one question. I see that the CEO has changed. I just wanted to know what exactly was the reason for that? And also the CEO was pro bono. Does that remain the same? Thanks very much.
Thanks. Honorable Shivambu.
No, thanks, Chair. One is that I want to take note that in terms of the payroll contributions, the Economic Freedom Fighters is the biggest contributor. Our contributions is even almost double what government payroll contributions have been into the Solidarity Fund, because we took this seriously, and it looks like other sectors of society, inclusive of the private sector and government, did not take this issue much more seriously than the EFF did. But I want to ask, how much money is spent on the administration of the Solidarity Fund? That includes broadly the administration, and if there is salaries that are paid or some rewards or whatever intervention that is made to the people who are managing the fund, just how much money of that is used. And I'm interested in knowing what the procurement policies like and framework of where are these procurement policies, because you never used government procurement policies, which in most instances will look into the redress component and black economic empowerment. And attendant to that is, what is the composition of the people who provided services and provided goods and products to the money that is spent by the Solidarity Fund? Because we might be having a picture or a situation where the Solidarity Fund spent the money that was donated by all South Africans to empower white people's companies only. Can we get that clarity in terms of who benefited from the procurement of the Solidarity Fund, so that we're able to make a proper assessment of that in terms of all of those issues? Also, you say that you have directly procured ventilators. Where did you buy them? Which company supplied the ventilators to the Solidarity Fund, and where were they manufactured in the manner that it is? And also, I see in your presentation, you list a lot of companies, private companies here, like you've got a lot of companies which you are mentioning here. Anglo-American, Discovery, Distel, all of those things there. And then in the slide 11, where you're speaking about other partnerships, where you're speaking about, you say you claim you have got partnerships with NGOs, civil society, traditional leaders, and faith-based organizations. Why don't you mention them? Who is this civil society that you have worked with? What did they do? Who are these traditional leaders that you have worked with? What did they do? Where? Who are these faith-based organizations that they've worked with, and what did they do and where? Like, who are these NGOs? Because we should know all of these claims that they are making here, instead of prematurely celebrating what we might think are your contributions will, if we're looking deeper into it, might be pointing to a different picture. So let's get that breakdown of all these issues that we've raised, Chair. And if there are issues that cannot be responded now, we must be sent detailed reports in terms of what we have asked now. Thank you very much, Chair.
Thanks, Honorable Shivambu. Honorable Morolong.
Well, thank you very much. Let me take this opportunity to welcome the presentation by the Solidarity Fund. Just a few questions, quite briefly. You know, what is a longer-term plan for the Solidarity Fund beyond COVID-19? In your presentation, you talk about the second phase, where we are now living with COVID in our midst. How do you think you can contribute to the building, better building of South Africa? Do you think, with the benefit of hindsight, that you would want to venture into job creation, given the fact that a lot of jobs were lost as a consequence of the COVID-19 outbreak? Will the fund be audited? And if so, when will its financial statements and performance be published? I think my final question is somewhat linked to what has been asked. Will the fund publish a list of all individuals and organizations that have benefited from the fund, as well as service providers? And I concur with the fact that we need to break them down into demographics. We need to know who are these individuals who may have benefited from this fund. Thanks, Chair.
Thanks, Honorable Morolong. Tebogo, are there other members who want to ask questions and make comments?
Stage, sir.
Pardon?
Not at this stage, sir.
Okay.
It's only the for now.
Okay, no problem. Over to you, Solidarity Fund. Can you please respond to those questions asked by the members?
Can I start, Chairman? Thank you very much, honorable members. I will attempt to answer a lot of the questions, and then I'll leave some for my members, including the CEO. The first one from Honorable Member George is the change of the CEO, and why was that? And she was pro bono. Does that remain the same? The answer to all of that is that, one, the CEO gave us 6 months of pro bono, which ended in September. And she was kind enough to stay until end of October so that she can hand over to the new CEO, because your pro bono, she had to go out and look for a job. And so the move was a peaceful one. We still work with her, and there was no complication about that leave. She gave us 6 months. The new CEO comes in November. I have to emphasize again, this is also maybe also answering Honorable Shivambu there, that how much is spent on the administration by the fund. It is very important for us that the fund does not carry the overheads, and that is what we have done. Including the new CEO is a secondment as opposed to pro bono, but not from the fund. I hope that clears that matter. I think the main point there is that the fund itself has no intention of carrying salaries or overhead expenses and all of that kind of thing. It should go to where it's supposed to be, either to the patients or health workers and all of that. So I hope, Honorable Shivambu, you being answered there as well at the same time as me answering Honorable Member George. You also then, coming to Honorable Shivambu, you wanted to know the ventilators. Where did we source them from? The ventilators were done with a CSIR because you needed a group of scientists to do that, and that was the best place to be, mainly and safely. That also is because there was no other place to get ventilators. You had to go outside, and they were very expensive. And so when the National Ventilation Project, which is a government project, actually created this program with CSIR, we're quite happy to be part of that. I'm just jumping around on the how did we work with people and all that kind of thing. I'll give you an example on the traditional leaders specifically. When it came to the issue of food in the rural areas, whether it is food parcels or it is the food vouchers or it is the farming, all of that, very important that the access to the rural areas was through the traditional leadership. We worked with the National House of Traditional Leaders, and which also put us in touch with the Provincial House of Traditional Leaders, effectively, in the end, we directed things to traditional councils, where we were now assured that with the traditional councils, you can then say there is no part of the rural areas that is not taken care of. That is, even the vouchers will be identified from the traditional councils up, and so is the food vouchers. We also did that one up. So the working with the traditional leaders is much more direct than we even say in the presentation. But maybe I can leave my colleagues to deal with the rest of the questions if I've left anything. The audit, we're being audited by Pricewaterhouse, and our audit will be for the annual audit as opposed to 6 months audit. Made no sense to audit for the 6 months other than to give an impact report. But the actual full audit will be for the year, February 2021. I don't know, can you then take care of the other questions, Tandi, Martin and Eddie? But I've dealt with some of them.
Thank you, Chair. Perhaps I can address the question.
Please. Hello, Ms. Tandi. Can I please request, if possible, unless you have got a connectivity problem, the parliamentary TV are requesting me again that if possible, please show the video. They are beaming this channel live, I think.
I'm so sorry, Chairman, I forgot, sorry.
Okay, no problem. Over to you, CEO.
No, thank you, Chair. I think I'm in a position to answer at least one of the questions, which is with respect to the long-term plans for the Solidarity Fund. So at this stage, Honorable Morolong, we anticipate that the fund ought to wrap up its operations within a 12-month period. It was set up as a rapid response fund in respect specifically of the COVID pandemic. And so and in fact, it was anticipated that it would have wrapped up already, but because of the second wave, we were conscious that we need to be able to also address the second wave. So once we have addressed the matters of the second wave, we believe that the country will be in a better position to deal directly in a more living with COVID type, as we live, for instance, with flu or measles and so on. So it'll become a normalized part of how society deals with the matters related to COVID. So we do not, at this stage, see that it will have a longer, the fund will have a longer life than to the end of next year, perhaps. Thank you.
Sorry, Tandi.
I could possibly attempt another question, and AD, you'll assist me if I am going off the rails here. In terms of publishing a list of the beneficiaries, I think the demographics are easier to deal with. However, we are constrained by the POPI and such legislation that speaks to the privacy of individuals. So we have, for instance, even with donations, there have been people who have asked that their identities remain private. And to the extent that we don't have explicit authorization to divulge individuals in particular, their identity, I think that might be difficult. I think in terms of demographics, that is definitely something we can do, because that does not divulge an individual, but it talks to a classification, a category. So that'll be easier. I think we can speak to groupings of people or companies, but I think it's difficult. It becomes more difficult when you speak to specific individual companies, except to the extent that you're given the permission to do so. I think in particular with individuals, individuals. And I'll leave it there. AD, do you want to step in?
Yeah, I mean, I just wanted to add that in respect of every disbursement that we've made, there will be, and there is currently, we've got reports on our website, but every single one of the disbursements that we presented today, there will be full, information and transparency about who all the companies that were contracted with, how much they received. So all of that, a lot of that information is already available, but obviously in areas where we're still contracting with entities and we're still executing projects, that information is not yet available. But as soon as this information becomes available, we do share it on our website. And that includes all the organizations that we've worked with as part of these different disbursement programs.
Then
we can leave it. We go back to Chairman Maswanganyi.
My chairman, if I may perhaps just speak to the policies, the procurement policies. I think that was one that was remaining unanswered. We have procurement policies that we follow. So we've got a governance framework. You'll be aware, for instance, that there's frameworks such as King 4. There's frameworks beyond just the frameworks that are applicable to government organizations. So we've put into place a strong governance framework, and within that framework, there are procurement policies which guide how we procure. So it's not a case of any individual can come to any other individual within Solidarity and there's a deal, but there's gates through which every process goes. And with the PPE, there was procurement through, as AD had said, B4SA, and even within that, there was an agreement as to how that must happen, so that we do not, so that we observe good governance. So there are strong policies, just to assure the committee that there are strong policies in place.
Thank you. Thank you, Chairman. We hand over back to you. Thank you.
Okay, thanks. Are there members who want to make a quick follow-up questions or comments before we adjourn in the next 7 minutes?
Yes, Chairperson.
Honorable Shwambu.
I've asked the question of how much is the Solidarity Fund spending on administration. Want a figure, we're not looking for, it's not too much. So how much is asking for a number? How much are you spending on administration of the fund? And there seem to be contradictions in terms of the response on the demographic and individual breakdown of the people who have benefited out of the procurement of Solidarity Fund, who must be given that there can't be any legislation that prevents people who want to provide services to a public Solidarity Fund and then they want to claim privacy that they cannot be known afterward. It's problematic. So that list must be made available, of course, in your website, but also you must account to Parliament in the manner that it is. We must be sent that breakdown in terms of these issues, including the list of NGOs and civil societies, because people like claiming that, no, we're working with civil society, we're working with faith-based organizations, but when you go into deeper detail of it, there is no clarity of just who that is in the manner that it is. So that those are the concrete follow-up questions that we are making in regards to all of these issues. Can we be given a breakdown of who benefited from the procurement of PPEs and all these other information that we've requested without these broad responses that do not help to solve the questions?
Can I answer, Honorable Chairman?
Over to you, Chairperson.
Yes, Honorable Shivambo, I thought I was much
Please,
specific on. Sorry.
Can you please switch on the video, Chairperson?
Yes. I thought I was much more specific on the administration.
Or
No,
so, let's do like this, Chairperson. Let me take all the comments so that you respond to all. Then I will close as we're left with 6 minutes to
okay.
the assembly. Honorable Morolong, quickly.
Well, thank you very much, Chairperson. You know, there was a direct question that I asked about the fact that as a consequence of COVID-19 outbreak, this country suffered job losses. And my question was quite direct, whether the fund is looking at venturing into job creation in the second phase, or even beyond its if its lifespan is to extend it. Thanks.
Okay. Thanks, Honorable Morolong. Over to you, Ms. Serobe.
Okay. I think the first one, Honorable Shivambo, I thought I was much more direct about no money of the fund is spent on administration. What you have here is over 200 people coming from different entities who have made it work. No salaries are carried by the fund. I hope this is now clear. And there's no administration. There's no such a thing that is coming from the fund to pay overheads. I thought I was very clear. Even the document does say the same thing. I hope that one is straightforward. On the issue of the opportunity for job creation, Honorable Morolong, we are mindful of the job creation issue, which is why when we did have the opportunity to look at the ventilator production in the country, we jumped for that opportunity. Where we can, we will, but mindful that the fund itself is a very short crisis fund meant to respond rapidly to the issues of the time. It may not necessarily do the job creation as we would have liked to do. One of those cases, for example, was our interest in whether the PPE production can be done locally, and do we have the capacity to actually be part of that? We look at those things, but where there is opportunity for job creation, we do, mindful though that the fund itself is a very short crisis fund. It may not be able to do it, but where the opportunity arises, they will definitely do so. Thirdly, Honorable Shivambo wants a list of NGOs. Again, the website is full of those, too many of these, because we've got the GBV, we've got the human, the food crisis thing here, with farming vouchers here. That list is, our website is pretty much kept up to date. If there is a requirement for us to give a whole laundry list of that to this committee, sure, we can actually do that, because we do that to donors as per request. So there's nothing mysterious there. In terms of who benefited from the procurement, we have to say that to the extent that the PPEs came from overseas, because South Africa was not ready for that, you can then say China benefited. It starts with that. People procured from China to bring PPEs here. And hence our interest in looking at whether the production of the PPEs locally is a possibility, or can the fund participate in that and all of that. But the biggest beneficiary of our procurement was overseas, because the country didn't have the PPEs. You can talk about who those agents, who were the companies who benefited, how quick. That too is also in the website. I thought that's what Tandi said. If you want names and people, that's a different matter. Because if you are now going to say Acacia Medical Society, whatever company, that's a different matter. But all of that is sitting in the website as to who were the companies. I need to stress here, Chairman, that with us specifically, even with the crisis, we did manage to segregate these duties of the procurement this side, the distribution this side, Old Mutual managing the administration of the payment of money this side, And then you've got this whole myriad of auditors behind us, Ernst & Young, Pricewaterhouse, and so on, and the contractual arrangements. That is how we could escape what you would call the governance lapses. We couldn't have that here because the duties were segregated. I thought we did answer this question, but if we still haven't, we will be happy to come back with more details. But the NGOs, there's just so many of these NGOs in the country, can give a whole list of who distributed food where, who gave the food vouchers where. It's also on the website. Thank you.
Okay. Let's leave it there, Honorable Shibambo. What we'll have to do, let's make a follow-up through the Secretariat and agree that we'll engage the fund next year and the audit report will have been produced. For now, because we are left with a minute to get into a plenary session. So thanks very much, Chairperson of the fund, Ms. Serobe, and your team. Thank honorable members and officials. And as I've said, we'll make a follow-up meeting next year. We'll agree upon as to when exactly next year. I think probably after the publication of the audit report. So let's adjourn, honorable members. If ever there are other questions, let's have members through Tebucho to send those questions to the CEO, and then we get responses, and then we take it from there. But for now, I think we have to adjourn here. Thanks very much. The meeting is officially closed.
Thank you, Chairman. Thank you, members.
You are welcome.
Chairman,
Thank you, Chair.
Pleasure.